involved in taking care of patients with trauma, both cervical and lower extremities and upper extremities, for over 50 years. And I'm certified by the American Board for Certification in Orthotics and Prosthetics. The design of the Halo system evolved over a period of a number of years when I found that there were problems using other people's product, especially on an emergent basis. I designed and we manufactured and patented our own Bremer Halo system, which is now the John Bremer system. And there's a company that came out with multiple sizes of vests that were done in plastic, 28, 30, 32, 34, 36, 38, and as you know, we go all the way up to 60-inch measurements. They had 7 different sizes of halo rings that went around a patient's head. You had to have really good training to do this application because the patient had to be supported on a metal spoon behind their head off the end of an operating table, off the end of an emergency room stretcher, so that the halo ring could be applied on the patient's head. The inventory to properly take care of a group of patients was really, especially on an emergency basis, was really difficult. So we had to come up with a product and had to come up with a system that would work for the great majority of patients. I just had to take care of people, and I had to be able to afford to do it. So I couldn't afford to have 35 different sizes of Halo and vest on hand so that I could take care of our trauma center. And the cost would have been exorbitant. So the first thing I did was decided to look at alternative methods of A, coming up with something that was relatively lightweight, B, that was adjustable so that we didn't have to have so many different sizes, and C, was relatively inexpensive and available in inventory in the hospital or in an orthotist office so that he could do an application or assist the physician in doing an application just in a 45 minutes or an hour in the emergency room. And that's what I think we've done with the John Bremer system. These accidents happen, the middle of the day, the middle of the night. They want us to stabilize these patients within a 45-minute period of time. And the patients come in all sizes, from children all the way to geriatric adults. So we had to have a system that either you had to have multiple systems that would fit these patients, or you had to have a patient that had to have a system that was very variable. So we built a system to the point that it is now where you don't have to have a huge inventory of sizes on hand, a huge inventory of styles on hand, and we can take care of the great majority of the patients, over the 90th percentile with cervical injuries, literally in a 45-minute period of time. Our system is set up to take care of almost any situation that may arise. The design, very, very rigid cast aluminum, aerospace type aluminum. It's heat treated, so it's very rigid. It's MRI compatible because there's a break in the ring with a plastic insert. The ring is designed, or the Halo crown is designed to go below the equator of the skull, which means that we get a better purchase on the patient's head, so that we don't end up with rings migrating or moving off the patient's head and popping off and losing the alignment that we had. It's something that again has been in use throughout the world now for over 40 years. And John Bremer Light system was developed to reduce the contact patch on the human body. We managed to design the vest so that it no longer presses on bony prominences. Much cooler, much easier to wear. But the John Bremer Light vest is the vest of the future. Now we have 2 vests, so the practitioner can choose between the 2 vests. That means that he has to have an inventory of 4 or maybe 5 at the maximum vests on hand, and it means that he's got choices to do everything he wants to do. We've been taking care of patients with Halo systems for over 40 years, almost 50 years. And we have given these patients safety with their fractures. We've given the physicians support and cared for these patients, again, for over 50 years with excellent results. The John Bremer system has been used worldwide. It is probably the most successful halo system in the world, and is used in Europe and is used in Asia with great success. I think history has shown that it's a product that works.